We will soon upgrade OpenEyes to version 3.3. This video demonstrates some of the new features in this version and some important changes we are making to the cataract and glaucoma surgery listing process. Here's the most important information. From Monday the 30th of September, paper listing forms for cataract and glaucoma surgery will no longer be required. The live version of OpenEyes is planned to change to version 3.3 on Saturday the 14th of September. Most people will see it for the first time on Monday the 16th of September. Most of the changes are small, but as this release is timed with the removal of paper listing forms, it's very important you watch this video. I will also be presenting these changes and the new cataract listing process from 1 PM on Thursday the 26th of September in the iUnit seminar room. This is part of the doctor's teaching, but anyone interested is welcome to attend. Please ensure you watch this video or attend the training, or both. A small improvement in version 3.3 is that OpenEyes can now maintain worklist state. In version 3.2, any date changes you make to the worklist are lost if you navigate away from the worklist and then back to it. As you can see here, the date has been changed to the 4th of September. When you return to the worklist, the date has been lost and you're back to the 6th of September. In 3.3, changes made to the date in the worklist are saved when you return to the worklist. Again, the date has been changed to the 4th of September. When we navigate back to the worklist after viewing a patient, the date remains on the 4th. Adding a comment to visual acuity. When OpenEyes is being used in the vision lanes, to add the optometrist to a patient record, and to record visual acuity, it's not unusual for the patient to have forgotten their glasses. From version 3.3, there's now a comment box in the visual acuity area where this or other comments can be recorded. These comments can easily be seen in the examination after saving. Image rotation correction. From version 3.3, it no longer matters which orientation you hold the departmental tablets when capturing photographs of patients. If an image has been recorded at the wrong rotation, it can now also easily be corrected. Problems and plans. This new feature complements the structured diagnoses in OpenEyes by providing the opportunity to record a non-structured problem or plan list. This is visible in the patient overview. Here you can see an entry that the patient may not have told the DVLA. By hovering over the eye, you can see who created the plan or problem, and if you press on the arrows, you can see any previous problems or plans that have been removed, when they were removed, and who removed them. If you hover over the management icon at the top of the page, new problems or plans can be added here. Click on a blank line and type in a new entry. Press the green button at the end of the line to save the new problem or plan. The three lines can be used to reorder the list as shown. Again, if you hover over the eye symbol, you can see who created the entry and when. The double arrows again document removed problems and plans. Manual override lens choice. Although most of the lenses we use in cataract surgery are available from the IOL master interface, there are occasions where a special lens is needed. From version 3.3, it's possible to manually enter a lens power and predicted refractive outcome as long as that lens has been added to OpenEyes. In this case, click the manual override button, pick the lens from the much longer list available within OpenEyes, and then manually type in your IOL power and predicted refractive outcome from your information source. When the biometry event is saved, you can see the manual data input has been captured. Also on the whiteboard, the new lens choice is documented accurately. OpNote text customization. A number of options have been added to OpenEyes 3.3 to allow operation note text to be entered in a semi-automated manner. For demonstration purposes, I have created a test configuration for cyclodiode laser. It is now possible for the OpNote text box to be configured on a per procedure basis. Also, the green button menus can be completely configured per procedure. If surgeons, including those who perform minor ops, would let me know their preferred text for each procedure and how they would like the green button text configured, we can make a start on this customization. Categorize diagnoses. The ophthalmic diagnoses selector has been improved to make finding a particular diagnosis more straightforward, but a category list has now been added to the left. This is fully configurable, and the list and contents displayed here are just for demo purposes. The structure and content of these categories can be different for each subspecialty. I would appreciate advice as to how you would like to see them organised in your fields of expertise. Note that multiple diagnoses can be added at the same time if they are in the same category. Further diagnoses can then be added by further clicks of the green button. Updated lab tests. For a long time it's been possible to add manual INR results to OpenEyes. Other blood tests and lab results can now be added, like a CRP shown here, or an ESR. Higher up, there is a CT MR scan report. These are not linked from other hospital systems, but need to be manually added in OpenEyes for future reference. The date that the event is created is recorded as the date of the test. So if you want to enter a blood test or report that's been done on a previous date, you will need to backdate the lab results entry. These rewind icons show when an entry has been backdated, rather than being entered on the day shown. To create a new lab test, select the lab results entry. If you do need to change the date, press the rewind icon and then select the date. Several lab results were available. Please get in touch to suggest changes and further tests. I've selected an HSV test. The available results are negative, positive for type 1, positive for type 2, and positive for both type 1 and 2. Free text comments can be added to all the lab tests. Note that the rewind icon appeared as the entry was backdated. Hovering over the icon displays the lab results type. Change to letter layout. In version 3.2 and earlier, the letter templates have been called macros and situated in the top left-hand corner of the new correspondence event. In version 3.3, these have been more sensibly renamed to letter templates and have been located a little further down the page on the left-hand side. The function is otherwise the same as before. Automated post-op events. This is the penultimate feature discussed here and improves OpNote generation significantly. You will now see at the bottom of the OpNote two new options, generate standard prescription and generate standard GP letter. It's unlikely you'll need to turn off generate standard GP letter, as one is always required. Generate standard prescription should be disabled if there is an unusual case that needs altered TTO medications. If both boxes are selected, when you press save on the op note, you will notice that a standard prescription and GP letter event will have been created. These are the same as the events that would have to have previously been created manually. The Create Standard Prescription event is only available in the cataract subspecialty. Standard letter creation is enabled for all operation notes. As mentioned previously, these boxes can be unticked if manual creation is desirable. From the 30th of September, surgeons will no longer need to create routine prescriptions for cataract surgery. Also, the ward nurses will no longer need to create the default discharge letters for cataract or glaucoma surgery. Please note, the nursing staff on the ward will still need to create the Optom discharge letters for those patients being followed up at community optometrist practices. Although we will be upgrading to version 3.3 by Monday the 16th of September, this particular feature will be disabled until the 30th of September, the same date when paper listing forms for cataract and glaucoma surgery will no longer be required. On-hold booking. This feature supports the removal of paper listing forms from cataract and glaucoma surgery. Please wait until the 30th of September to start using the on-hold function. From then on, cataract booking forms should be created in OpenEyes in the same way as usual, which is shown here. As usual, continue to create two op booking forms if listing for surgery for both eyes. Please also continue to document which eye is first and which eye is second in the comment box. Here is demonstrating the creation of a second booking form for the second eye, with the documentation of second eye in the comments box. From the 30th of September, the second eye should be placed on hold, and no paper booking form will be needed. Choose awaiting completion of first eye for the reason, and then press the Put on Hold button. Notice that the booking event sub-icon changes to a pause icon to denote the on-hold status. Whether listing for cataract surgery in general clinics or in ECAT clinics, the process is the same. If you are listing for one eye, proceed as previous, but don't create a paper listing form. If you are listing for two eyes, create two OpenEyes listing forms, but place the second form on hold, and don't create a paper booking form. In ECAT clinics, the pre-assessment nurses will also place the first eye on hold if the patient is not fit for surgery. When the patient is re-referred and then fit for surgery, the admission staff will take the op booking form off hold. This process should also be performed by the doctors in clinic if they see a post-op patient who has completed first eye surgery and wishes to proceed to second eye surgery. In this instance, the second booking form would likely still be on hold. If the decision has been made to proceed with second eye surgery, please take the second booking form off hold. This process could be performed in a general clinic or in the cataract post-op clinic in the eye unit. To take a booking form off hold, simply press the Take Off Hold button, and the sub-icon is updated with the pause indicator being replaced with the usual sub-icon. Remember, please do not start using the On Hold function until the morning of Monday the 30th of September. Here again are the important dates to finish this video.